I am Izabella Natrins. I am the Chief Executive of the UK and International Health Coaching Association. We are the oldest professional body, in fact, the first professional body for health coaching in the world. We are a body that sets professional standards and maintains professional standards, and we are here to promote and further the cause of health coaching across the globe. Health coaching is a powerful, evidence-based modality that helps people make lifestyle modifications and change behaviours in favour of healthy living. It's much more about the how we make changes to our lifestyle to what we should do. Health coaching covers whole health, and by this we mean every aspect of a person's health, not just their physical health. So we can include the biological aspects, the physical aspects, the emotional aspects, the psychological aspects, one's social environment, one's spiritual environment, and also the ecological context in which an individual lives. All of these elements make up a whole person. So we, as health coaches, we want to understand an individual not just as a body in front of us, a physical body, but a whole person in their whole environment throughout their whole lifetime. Health coaches help people to find the motivation, very importantly, to find the motivation to make the healthy changes. They use communication skills, tools, techniques. It's very important for the health coach to help a patient find reasons why they will keeping on with the new behaviour that will help and support their health. The concept of shared decision making and supported self-management is really important, and by this we mean that the doctor or the health coach and the patient work together to have a more equal relationship in that consultation, so that it's not about the doctor or a health coach telling the patient what they should do. It's working with them to discover what it is they would like to change most about their health behaviours, where they would like to start. The coach helps the patient identify where they'd like to start. They will work with them to identify what challenges that might bring. It could be personal challenges, it could be challenges within their lifestyle, within their family. And in the conversations and the communications during the coaching consultation, each partner plays a part in creating a plan for the patient to make changes, and very importantly, to help that patient grow a sense of self-accountability so that they feel responsible for their part in the relationship. And this really helps motivation when they see that the changes they are making them feel better. Maybe it's reducing their symptoms, it's improving their quality of life, and this helps them keep on making those changes and improving their health. There are a number of ways that health coaching can be applied within a therapeutic relationship. For instance, it can be preventative, so the health coach and the patient can work together to prevent the onset of a diagnosis. It may be that, for example, somebody is having some issues which suggest that they may progress to a diagnosis of type 2 diabetes. If we can help that patient make changes to their nutrition, to their lifestyle, improve their movement, their exercise during the day, help them sleep better, help them manage stress, we may be able to prevent the onset of type 2 diabetes. a patient with a diagnosis of type 2 diabetes can improve their symptoms, can improve their test results, and can even, in many cases, reverse the diagnosis. Similarly, we can help patients with a cancer diagnosis, in that we know now that cancer, the progress of cancer can be supported by physical activity. So with a health coach's support, a patient can work towards sustained improvement in how they move, how often they move, and this can make a real difference to their quality of life, their progression through their treatment, and ultimately to their optimism throughout their cancer journey. It's important to remember that health coaching has a very strong evidence base for outcomes for patients. There are a number of sources of this evidence, and one of the most comprehensive is a compendium of health coaching outcomes that was produced by Dr. Gary Sforzo and Margaret Moore in America. Margaret Moore is one of the leaders internationally in health coaching, and they have produced a compendium of evidence of more than 200 studies which show that health coaching has a very big impact on all kinds of chronic diseases. For example, chronic diseases such as obesity, type 2 diabetes, high blood pressure, and even aspects of cancer in cancer behaviour and cancer progression. Another good source of evidence is the NHS, the National Health Service in the UK. This contains a lot of case studies where we can see how health coaching has been applied in the UK in a variety of clinical settings and the benefits that patients have seen there. Dr. Ruth Walliver in the United States has recently completed a study where they looked at whether health coaching interventions in physical activity were sustainable. And the results were very encouraging in that they found that the patients that they worked with, after 10 health coaching sessions, were continuing to implement their behaviour over 6 months after the coaching sessions had finished. So this is an important study because it shows that health coaching doesn't just work during the process, but that the patients sustain the behaviour afterwards. A very recent study from Stanford University has looked at the issue of weight loss and obesity. There's an argument to say that AI, digital health, and apps for supporting people to make lifestyle and behaviour and dietary changes are very effective. So Stanford University looked at 65,000 consumers of an app that supports weight loss management. They compared the use of the app on its own with the use of the app with a health coach at the same time, and they found that patients made nearly twice as much weight loss change with the support of a health coach compared with the use of the app on its own. So lifestyle medicine is really the medicine of life, the medicine of living a healthy life as we have evolved to live it as human beings. Our modern environments very often prevent us from living the kinds of lives that keep us healthy. The GP is a medical expert. They have all the ability, the knowledge, the skill and the experience to help a patient make changes and improve their health condition. A GP with a health coaching qualification is a very powerful practitioner because not only are they able to understand how to help a patient from a medical perspective, but they can also support them in how to make the changes in their lifestyle and behaviour that will make a difference to their health condition. So we have this additional scope of practice. So in a multidisciplinary team, this is a very powerful position. The medically qualified health coach can support the patient, and they can also be an educator for the rest of the multidisciplinary team to help them understand the power of this new lifestyle change modality. UKIHCA is the first professional body for health coaching in the world that has made self-regulation important for health coaching. We have over 750 members in our association and another 1,500 members who are health coaches in the NHS. We set robust professional standards for health coaching. So we determine the curriculum for education and training for health coach providers. These standards are very high. They are the highest in the world. And our education and training providers, the programs that they develop, have to meet our standards in order to meet our approval. Once they have met our approval, they can be sure that they are amongst the elite providers on the planet globally. Not only do we set professional standards, but we also determine that our coaches, in order to maintain their membership, must provide every year continuing professional development. So they need to keep their development and their learning up to date. We're also introducing now supervision so that they can develop their professional competencies, and we provide a very strong community. The association is built on 3 strong pillars. The first is professional standards, the second is community, and the third is enterprise. Georgia is a change maker globally. Georgia is one of the leaders in healthcare innovation in Europe, and indeed with EVEX, it's now a global innovator in health coaching. The Georgian health coaching qualification for doctors is the first of its kind in the world, and EVEX are leaders in this field. The team that has developed the qualification and the team that will be implementing it throughout EVEX clinics and influencing Georgia health policy ultimately are change makers, and there is a huge congratulation to be offered to EVEX, to Team EVEX, and to Georgia as a country for this leading edge work.